Prednisone can affect men in ways you may have never heard of, from hormones to moods to bones. Listen to find out exactly what you need to know and what you can do about it. Hi, I'm Dr. Megan, your prednisone pharmacist, and I've been asked many times, how does prednisone affect men differently than women? Well, I'm going to explain what prednisone is, which explains how prednisone affects men differently than women. And then at the end, I'll explain exactly what you need to do about it. So, prednisone is this amazing medication that was invented to mimic our body's naturally occurring hormone, cortisol. And if you check out this image of cortisol, you can see that it looks pretty much exactly the same as our hormones that our body uses for other purposes, like testosterone, estrogen, and progesterone. If you've heard of any of these, you'll know that testosterone is our male hormone and estrogen and progesterone are our female hormones. And prednisone looks pretty similar to them. In fact, these hormones, from cortisol to progesterone, are all related and can interchange between each other depending on the situation. Your body has these enzymes that change them from one to another. And sometimes when prednisone is high enough or the body's reacting weirdly enough, the prednisone can affect these downstream hormones. And so instead of doing what we want the prednisone to do, which is help with our autoimmune condition or help with our inflammation or arthritis or our asthma, any of those situations, it's causing downstream side effects because it's affecting these other hormones. So I'm going to first cover how prednisone can kind of turn into estrogen and progesterone, leading to female-like side effects. Then I'll talk about the male-like side effects that can be worse. So all of these are incredibly rare. So don't be thinking that, oh my goodness, I'm going to turn into a woman because I took prednisone. Not true. It's just a possibility that a few people have reported. So first of all, breast changes. So some men have reported breast tenderness because prednisone is causing weight gain. They've gained weight in the breast area. And so this usually does reverse once you stop taking prednisone, but it is possible to gain weight in the central area from the belly to the face and to the breast area. Next, the penis can change. Some men have reported their penis getting smaller, and there have been changes to the sperm count. So some men have had harder times with fertility because of dysmotility. That's how well the sperm can move, like how well it gets where it's supposed to go. The sperm count can be lower, and essentially it can just be harder to be fertile while on prednisone, which is funny because some women have to take prednisone for the reason that it's causing their infertility. So prednisone is this two-edged sword always, that it can help with fertility and it can help causing infertility. Then the stereotypical thing you think of when you think of a menopausal woman is hot flashes, right? And that's because of the fluctuations of the hormones of estrogen and progesterone and them not being in the right balance. Well, that can happen to men too while on prednisone. You can have red flushing cheeks. You can have temperature dysregulation, like you're not able to regulate your temperature properly. So you might get sweats, you might get chills. Any of those things are possible, not necessarily likely, but they're possible while taking prednisone. Next, let's talk about the testosterone-related changes. So when we think of men, we often think of facial hair. And so women can get facial hair and men's facial hair can change because of the prednisone. And male pattern hair loss can also happen, can be hurried along by the prednisone. But what's also confusing is prednisone can be used for autoimmune hair loss called alopecia areata, stopping that kind of hair loss. Again, double-edged sword. Then the voice can change, whether it can be getting a huskier, deeper voice than usual, or even a higher voice. Those are possible changes, but very rare. The sex drive can be diminished, and it's possible that there's just not much drive to do it. Finally, facial acne is a possibility, or acne in other places. Worsening acne that you've never had before, is a possible side effect from prednisone that is related to testosterone changes. Men also have stronger muscles than women. because of testosterone. And it's not just because of testosterone changes, but muscle wasting or muscle loss is definitely a side effect of prednisone. Having the nutrition and the goodness stolen from the muscles and redistributed as fat throughout the body, especially on the face and belly. I had one guy tell me that his friend didn't recognize him and thought he must have been his own brother because he had this big round belly. Another man called to tell me that he's a competitive bodybuilder and he was having a hard time continuing to compete because he lost so much muscle mass. And he wanted to know, is it safe to continue? What should I do? And so for him and other people who are worried about maintaining muscle mass and not having muscle loss or sarcopenia, it's important to continue to eat healthy foods, to eat muscle strengthening foods like meat, collagen containing things, protein in general, and with doctor's permission, continue weightlifting. Doctors who prescribe prednisone the most, called the American College of Rheumatology, they do recommend weight training things, not going from zero to competitive weightlifting, but definitely doing things to support your muscles and your bones while on prednisone. The next type of side effect that is different in men than women are psychiatric side effects. And I get phone calls very frequently from men who are surprised. They had previously been otherwise healthy and functional, fathers supporting their family with a full-time job, able to be around their children. And suddenly they took the prednisone and now they're not able to go to work. They're not able to be around their children. The anxiety and the panic attacks and the jittery, unsettled feeling is so intense, they cannot function. I interviewed the author of a book about a man who had such terrible prednisone mood changes that he was hospitalized for, it's called steroid-induced psychosis. And these dramatic psychiatric changes, delirium, mania, they tend to be worse in men. Women tend to get more depression. Men tend to get more activating things that make them go from normal to what is happening to me? I feel crazy all the time. Do I need to be admitted to the hospital? And it's possible that you do. And it's okay because it's temporary. It's only while you're on prednisone. And if it's causing such horrible psychiatric changes, then prednisone's generally not a good idea. And so you need to work with your doctors to get the help you need, whether that's stopping the prednisone only under doctor's permission, or getting on psychiatric medications, or getting therapy, being hospitalized, doing whatever you need to do to stay stable while on prednisone. It's okay. It's not you, it's the drug. Remember, there's a distinction here. You're not crazy. You're suffering a side effect from the drug. And so doing whatever it takes to get you back to functioning is worth it. And there's no shame at all. The last side effect that can affect both men and women, usually worse in women, but can be different in men, is bone loss. And the bone loss can lead to osteoporosis. And so back to the American College of Rheumatology, they recommend that people on prednisone take calcium and vitamin D, to do exercise and stay in a healthy weight, to not drink alcohol and not smoke while on prednisone to help support your bones. And another story of a young man in his 30s. He had taken prednisone and then he suddenly had this horrible hip pain and was having to use a walker in his 30s because he couldn't walk. And I don't know for sure, but it sounds like going from normal being able to walk to, after taking prednisone, your hip not working. It could be a disease called avascular necrosis, where there's actually bone death in the hip joint and he's not able to walk. And so if you're suddenly having hip pain, back pain, shrunken height or stooped posture, things like that, that could be symptoms of bone loss. Definitely let your doctor know. And so if you want a list of all of the things I recommend, I've recommended a lot of them throughout this video, then you need my printable, downloadable prednisone checklist. It includes all of the things you can do to counteract these side effects and more, and is easy to use, and you can just follow the steps To know exactly what you need to do to counteract side effects while taking prednisone, just click the link below to download my prednisone checklist now. Signing off as Dr. Megan, your prednisone pharmacist.